cosmetic medicine has literally exploded with new procedures, devices, injectables, all sorts of different treatments, all promising to make people look younger with less downtime, less risk, and ultimately easier results. Some of these innovations ultimately failed to live up to their promises. And despite everything, some of these are still very popular today. So we're gonna discuss them. And by the end of it, you're gonna be in the driver's seat. You're gonna know what works, what doesn't work, why. If you're considering doing anything to your face or your body, understanding this history can definitely help you save not just time, money, but also regret. And for those of you who don't know me, I'm Dr. Karam. I'm a facial plastic surgeon. Let's get into it. First up, thread lifts. Probably one of the biggest repeat offenders in aesthetics. Thread lifts history starts like 20 plus years ago when I was actually a resident. Everyone was jumping on this bandwagon. But what we ended up realizing very shortly after is that not only did they not work, they didn't hold up, they caused all sorts of problems. These were back when we were using barbed, non-dissolving sutures, and you'd put like 7, 8, 10 of these into the face and neck, etc. All sorts of issues were happening. But I remember the first one that I did, the patient was in so much pain afterwards. The skin was all bunched up here because what you do is you stick them in here and then you lift everything. So everything gets bunched up. And then I walked away. I'm like, well, how is this going to play out? Sure enough, after several weeks, the bunching relaxed, but so did the outcome. And by 2 or 3 months, 4 months, it was like nothing even happened. Well, it took about 2 years roughly until that company went bankrupt, but literally 10, 15 years later, it shows up again. Now today, they're on the market as these PDO dissolving thread lifts, and the results are basically the same. It's essentially very minimal downtime, quick recovery, but the problem is you're trying to lift the deep fascia and these threads can't do that, especially if they're dissolving in 3 to 6 months. Well, guess what? Tissues begin to descend again. You've got this very temporary procedure that gave you momentary improvement and then went away. So for a lot of people, it ends up becoming an expense, a repetitive type of a procedure, and never quite replaces a facelift result. So they end up disappointing a majority of people. And if you're one of the unlucky ones and you end up getting puckering and asymmetry and visible pulling, plus not to mention pain, then you're really regretful that you did this procedure in the first place. Basically, cat's out of the bag on that one. It doesn't work. And by the way, if you are enjoying this type of honest education and my points of view on cosmetic procedures, skincare, and aging well, I send deeper insights through a weekly newsletter called the Karam MD Journal. I'll put the link below, so make sure you subscribe to it. You'll love the content, and it gives us an opportunity to kind of delve in a little bit deeper than we'd even do on these videos. All right, so let's talk about number 2, the non-surgical facelift era. Now, here's where I get very, I guess I feel empowered somehow because I have personally, from day one, have stayed on the sideline on this entire category. We're talking about energy devices. We're talking about like using ultrasound, radio frequency, this entire category of energy devices used to replace a facelift surgery has come in all different shapes and sizes. Dozens and dozens of different companies and brands have come out, and they don't lift the face. Simple as that. You might get some subtle improvements. If you're in your 30s or early 40s and you're getting a little bit of laxity, you could try this, but it doesn't postpone the process of laxity that happens at a much deeper level. So you'll ultimately be in the same place as you would have been if you didn't do the procedure and taking on risk for no great advantage. And I think that's where, especially radio frequency recently has gotten a lot of bad press. The FDA came down on it because there's a lot of serious issues that came around it. And one of the biggest ones is the fact that deep use of these treatments can sometimes melt away that very, very precious subcutaneous fat that lives underneath the skin, and that can actually age you. So in addition to it not living up to lifting your face, sometimes you can have some very negative impact. Now, if you're using some of these devices in a very controlled and very gentle way, like superficially, you can potentially see some improvements in your skin, but not in the shape of the face, not by lifting your tissues. That's a big difference between something that improves your skin versus the shape. So keep those two things separated so you're not disappointed. So next up is the non-surgical liquid facelift, the use of fillers, basically. And here I do get some blame because I was actually, for many years, one of the instructors, the physician thought leaders and community trainers for fillers and Botox and things like that. I'm not gonna say I drank the Kool-Aid, but I truly believed that volume was an important part of facial aging, which I still do. However, what I realized just through my very, very robust filler clinics that I used to do for almost 15 years, I was doing a lot of filler in addition to surgery. But what I realized on my own was that when people are in their late 40s and early 50s and beyond, and they have a lot of laxity, putting fillers in their face, in their cheeks, in their jawline, all this stuff, all these techniques and maneuvers doesn't actually do anything. You end up looking at these faces after you've injected like 4 or 5 syringes of filler in there, and you look at the person and they look just as old. That's just a waste of money, right? Bottom line is, in subtle ways, in somebody who's younger in their 30s and 40s, just gentle little fillers here and there can have a very lovely effect, refreshing and improving certain things. But if you're older and you've got laxity and you're hoping to fix it by filling your face, you're gonna be disappointed. It's just simple as that. So I love fat transfer. I do it in addition to my surgical facial rejuvenation procedures. I do it as a part of vertical restore nowadays. I don't do fat transfer in somebody with laxity ever anymore. And I did a lot of them, and I, again, learned the hard way. Patients weren't super thrilled with their outcome. So there you are. Let's talk about buccal fat removal, number 4. I did videos on this as well. Buccal fat pad removal is when you remove the cheek fat pad to kind of create a slender look to the face. Now, this became a trend twice. The first time it became a trend was back in the 70s, 80s, and it was just because for some reason I think models were viewed to look more beautiful if they were, they had high cheekbones. So the idea was to take the fat out of here so the cheekbones appear more prominent. So it's basically a cosmetic type of a concept. Problem was, and again, this is one that I take credit for because I stayed off the side. I'll tell you which ones I participated in. This one I stayed out of it. And the reason why is because I noticed that people lose volume in their face as they get older. And I thought it was kind of silly to take a 20, 30-year-old, take out their buccal or cheek fat pad and basically accelerate the aging process and make them look more gaunt as they got older. And sure enough, that's what happened. Not a good idea, bad trend. Don't do it, especially if you're younger, you're gonna regret it. And at the end of the day, who wants to accelerate their facial aging? And I cannot tell you how many times people have come to me and have asked me to put fat back in their face or filler back in their face because they had a buccal fat pad removal when they were, younger for whatever reason. And here we are. There are indications for removing this buccal fat pad. There are some people who have overly large buccal fat pads, but as a general move, that is not a good idea for most people. Very, very specific, very rare person who would benefit from that. Because remember, anytime you're removing something, so permanent subtraction should always be approached carefully because aging itself is already subtractive in the volume department. So be careful about that. We have talked about this whole RF microneedling category. We did a whole video on it. So just keep in mind, the only thing I want you to walk away from this section on is think millimeters. If you're doing RF microneedling, and we have a device in our office, but our device is designed to go very superficially and just treat the skin. So what do we use it for? We use it for people with acne scars. We use it for people who have surgical scars in some cases. We use it for people who have some crepiness. It basically stimulates collagen in a more accelerated way. That's the theory, by adding that little extra energy. But we keep it under 1 millimeter. Keep RF microneedling under 1 millimeter and you'll be fine, as long as you're focusing on your skin only. The minute you go 2, 3, 4, and beyond millimeters, you're getting into the deep facial fat, and that's where you can accelerate aging process, etc. So is it a useful tool? Yes, for skin changes, but as a lifting agent or tightening, it is no magic wand. So just keep that in mind. All right, so number 6, which is actually the reason why I thought about this video for you all. So this is also one that I stayed on the sideline. Again, I take credit where credit is due. This one received enormous hype. I'm telling you, it was at all of our conferences. We had, laser people coming up there teaching facial plastic surgeons, if you can believe it or not, how to do vaginal laser tightening, various rejuvenation things, etc. And there's all these different devices that came for it. I thought it was crazy, first of all. You're coming to somebody like myself who specializes in the face and talking about this and wanting us to use it. I mean, I get it if it's an OBGYN, I get it, whatever, but it doesn't really fit into my practice, but a lot of my colleagues jumped on this and brought it into their practices, had their nurse practitioners do it literally at the same time as their patients getting a facelift. They get a facelift, and this treatment as an add-on didn't sound right to me. And here's why it didn't sound right. It literally has only been around, before they brought it to market, just for a short period of time. I mean, there was no long-term study. There was no whatever. We had neighborhood friends and things like that were getting it done. And sadly, a lot of complications came from this. And some of them were permanent. Thankfully, this literally has become like a non-treatment effectively. But again, another one of those like super hardcore marketing, campaigns only be met with disappointing results. So this is the theme that I'm seeing. Aggressive neck sculpting. Again, something that's been around for a long time. These things come and go in waves. And I've done a surgical paper and a textbook for this topic. Currently, it's a little bit more prominent for surgeons to go in and try to clear a lot of different things out of the neck, deep fat pads, muscles, glands, etc. I'm personally not a fan of this approach. I don't feel it's necessary to get a beautiful neck. I feel that sometimes these type of procedures can create an ultra sharp neck structure that doesn't look quite natural, doesn't look soft and youthful, even more skeletonized, and creating hollows and deformities in specific areas and irregularities creates an over-operated or even just an operated look that I'm not a fan of. So to me, again, this is one of those subtraction concepts that you have to be careful of, because once you remove all this stuff, you can't put it back. So I'm a bit more conservative about this. The best rejuvenation restores things, makes things look like they used to, puts things back to where they were, not necessarily a completely new look. And that's a guiding principle that keeps my patients from looking distorted after surgery. So that's my take on that one. And a lot of people have been asking me to speak on that issue. Number 8 is CoolSculpting. This is one that I fell for. A lot of, hype around it. A lot of people I trusted telling me that this is a good way to go. We had some nurses in our practice that were very excited to be able to do this for their patients, etc. So I pulled the trigger. So I went all in, wanted to make a great patient experience, bought 2 CoolSculpting machines. My team used it. And I think there was probably some mixed results out there, but at the end of the day, it definitely did not live up to the hype of being a non-surgical liposuction type of a treatment. And really, at the end of the day, for me, if something is not living up to expectations and creating the kind of results that people are expecting and only giving somebody a modest outcome and they're spending all this money, it didn't feel right for me. So about a year and a half into that journey, I got rid of the machine. Basically sold them for nothing. The thing that I think scared me also was that not only there was the results kind of a problem, there was also this threat and concern about this rare complication that is called paradoxical adipose hyperplasia, which basically means that you do CoolSculpting to melt the fat, but all of a sudden the fat ends up getting a life of its own and actually grows more, almost like a tumor. Now you have to basically go out and surgically remove it and liposuction and all this stuff. I didn't want any part of that. Thankfully, we didn't get any of that and we got rid of the thing. But if you've had some experiences with this or you're using it currently or whatever, share. And this goes for any of the things that we're talking about here. Listen, it's not just cosmetic surgery. It's not just facial rejuvenation surgery. It's medicine in general. Sometimes we just learn the hard way. We get behind things, we convince ourselves that these are the right things. And it's not because we're dumb and naive or whatever it is, but because just paradigms. And the bottom line is only sometimes time will clearly elucidate these things. And I try my best to stand in front of it and try to really understand it. But what I've learned, one of the things that has kept me and my patients out of this type of trouble is normally when a new technology comes to the market, I typically wait a couple years before I consider it for my patients. Usually by 2 years, there's enough, the hype is behind us and there's some truth there. And if you can investigate and look at studies and talk to people who you trust, for me at least, I can decipher between facts and fiction here and make a good decision about what to introduce for my patients. So this is not a anti-innovation video. I'm pro-innovation, pro-bringing things for my patients, but just bottom line is some technologies help patients and others will have some real danger. And when marketing hype ends up overpowering actual biology, that's where we get into trouble. So you got to take a little bit of caution when making these decisions and find practitioners and doctors, et cetera, who you trust, who can guide you. But really, really importantly is for you to have the tools and the understanding. And one of those tools is that there are things that improve skin quality and there are things that are related to structural aging. And those are two totally different things. So skin and shape, this is what I always talk about, like the two sides of the aging spectrum. And then number two, there's no shortcuts around anatomy. So if something sounds too good to be true, it likely is. So if tissue has descended, and the whole shape of your face has changed, that's a different matter than if your skin is damaged. And that's where, for example, skincare matters the most. So if tissues have descended, lifting matters. If skin is damaged, skincare matters. Trying to use one category to replace another is where disappointment happens. And what I mean specifically is if you try to use skincare to lift your face or go get a laser to lift your face, you're going to be disappointed. So they're two separate things. So here's what actually tends to age well over time. And hopefully the next 20 years will make less mistakes than we've made in the last 20 years. But being conservative with your decisions, I can't underscore this enough. Focusing on natural results. Certain things have changed to get you to this point. All you want to do is go back. You don't want to alter. You don't want to go take a right-hand turn when the direction is reversed, right? So that's the idea. Prioritize healthy skin. Whatever you choose to do, whether you want to have surgery in the future or not, having youthful, beautiful skin, and that happens with what you do at home, what happens with sun protection, etc. That's where you're going to be able to really make an impact on 50% of the aging process. That's a really important point to get across. Getting proper diagnosis with people you trust. Stop watching doctor after doctor trying to tell you something on social media. Trends are not the way to go. Hype is not the way to go. Not whatever social media is obsessed with at the time, at this month, is what you should be obsessed with. All right, folks. So if you enjoy these type of honest conversations, make sure you subscribe to the channel. Make sure you share this with some friends and family. And I also would love to hear from you in the comments if you've had some of these procedures, what your take is on it, and if this was helpful for you. If you want deeper weekly insights into skincare, procedures, longevity, rejuvenation, join my free Karam MD journal with a description below. All right, folks, that's it. I'm Dr. Amir Karam. Hope you enjoyed the video, and I'll see you in the next video next week.